Alright, this is exactly how I passed the NCLEX for the NCLEX RN. And I'm sharing this because it's like graduation season. People are graduating from nursing school and they're either still studying for their NCLEX or they're planning to take their NCLEX within the next like few months or so. So this is everything I did to study and pass my NCLEX on the first try. So first of all, I scheduled my NCLEX 1 month after my graduation date. I did not wait. I didn't want to put too much time in between because I feel like so many people have told me this. The smartest you'll ever be is right after you graduate from nursing school. Like everything you need to know to pass that NCLEX is like literally right after. Anything longer than a month, you kind of pushing it, in my opinion. So I graduated May 8th, 2021, and I sat down and I took my NCLEX June 6th of 2021. So as far as my study habits, this is exactly what I did and how I studied. Things I used, UWorld and Mark Klimic. So I would study for 2 hours twice a day. So the 2 hours is whatever I wanted to do. So if that was like just driving and listening to Mark Klimic on YouTube, I would do that for like an hour. If I'm running errands or something, I would put my headphones on and just listen to him talk for an hour, maybe two. Then I would turn around and later on that same day and do UWorld questions. And I would just do questions on every single topic, and then I would focus on which topics I was struggling the most with. And to this day, I still struggle with GI topics, but that was one of my struggle topics was GI. So I would sit there and I would do those for like 2 hours and I would rest. So I would spend a total of 4 hours a day just studying, doing it the way that I wanted to do it. And I really liked using UWorld because it looked just like NCLEX. So when I sat down to take it, I was like, oh, this is what I've been doing for like the past month. Now, granted, my nursing school program, they did try to get us to like ATI. You can use that to study. I didn't really use that much. I really relied on UWorld and Mark Klimic. And I did not try to burn myself out on the studying. I just did my 2 hours like I wanted to. So I would do 30 minutes here, 45 minutes here, an hour here, just as I had it throughout the day. And it was something that I could maintain until it was time to take my NCLEX. Now, the night before NCLEX, I did not do as much studying because I was just trying to relax, get myself together. And I took it in 2021, so it's not quite next gen when I sat and took it, but it was still like they were doing some practice gen questions on it. So but yes, and I did the quick results through Pearson VUE, so I got my results in like 2 days and I passed. So that is exactly what I did to pass NCLEX on the first try. And this is for all the nurses that are sitting for their NCLEX within this month or the next month because it's post-graduation season. And if you pass NCLEX, how many tries did it take you? What did you use? And what advice do you have for nurses who are sitting and taking this exam trying to get their nursing license? Let's talk about it in the comments.